Dear friends, we are here today because the health of women, children and adolescents is under attack through compounding crisis of conflict and climate change, as well as policies that shift priorities, cut funds and restrict access to care and human rights. Thank you for gathering and thank you for caring. The global pandemic helped to crystallize just how vulnerable the health of women and children can be. And as instability grows, the goal to ensure every woman, child and adolescent survives and thrives is at increased risk. The only thing to do is to come together, commit to health and take actions that support and enable the delivery of basic health services to every community around the world. Half of the world's population are living in humanitarian and fragile settings, and there is a record high number of conflicts. Since February 24th, Russia's unjustified and unprovoked invasion of Ukraine has devastating effect on the people of Ukraine, in particular the most vulnerable. Ukrainian women and girls have been the victims of the unseen barbarity that the Russian forces have unleashed on civilians in Ukraine. As Jana just shared, the current war in Ukraine is a prime example of how these crises start and how political fragility directly impacts the lives and health of women, children and teenagers. Now, and of course, in the long term, as atrocities seem to be reported every hour, Ukraine is top of mind and of great concern. In contrast, though, many of the 56 active conflicts have been going on for years in countries home to over half the world's people living in poverty and long past the international news have moved on. Crises are felt globally, but the effects are especially hard where social and economic conditions are already unstable. In every setting, the health of women, the health of children is impacted acutely. Please look at East Africa. First, severe drought, then the economic impacts of the global pandemic, and now the war in Ukraine, which is further impacting food supply. This already unstable region is experiencing food insecurity that could cause malnutrition in 5.5 million children. Shifting to Syria, 11 years of conflict have set development back 25 years. Essential, basic services like health, nutrition, water, sanitation, and education have all but stopped. In addition to concerns of severe hunger and the collapse of services, there has been a resurgence of polio in Syria, cholera outbreaks in Yemen, Ebola in the Democratic Republic of Congo. Between 2009 and 2017, there were 364 disease outbreaks in 108 refugee camps. These realities are a stark reminder that crises last for years. What kind of future are we looking at if we leave current and future generations fighting to survive, only to bear the burden of years spent without the support they need to be healthy, productive, happy? Some of the impact is physical, easy to see, but the mental impact, as severe, is invisible. When people, especially women and girls, are driven from their homes, they are at particular risk of falling prey to traffickers, forever changing the course of their lives. It's a lot to take in, but we are talking about real people, women, children, who are simply trying to live their lives, stay healthy, raise families, go to school, make dinner, in the midst of the most dire of circumstances. For the sake of each woman, each child and adolescent, and for the sake of ourselves, we must move beyond talking and start implementing a rights-based approach that focuses on equity and addresses the needs of the most marginalized. It is encouraging that prior to the global pandemic, the world was making progress toward improving the health of women, children, and adolescents. But this progress was admittedly fragile and halted in 2020 abruptly, with a turn in focus and loss of funding. Unfortunately, it seems that the threats will only continue to evolve. The goal of every woman, every child, and the Partnership for Maternal and Child Health is to leave no one behind. We must restore the funding to programs that support the health of women, children, and our youth. We must also prioritize building systems resilient to these ongoing shocks. In addition to funding, we need preparedness. We need response mechanisms that address the needs of people experiencing the ongoing and compounding crisis. Effective mechanisms will specifically address humanitarian settings and prioritize the protection of healthcare workers themselves. Uninterrupted access to quality primary healthcare, especially in the presence of conflict and crisis, can save and improve lives. And let us also understand that money spent in each and every country will remain in the economy. It will help to grow economies as well. But if it enters at the point where there are the most vulnerable, children, women, health workers, it will benefit these people much more than simply building or rebuilding infrastructure. Thank you for caring. Thank you for thinking along.